Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Bridget Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, and welcome to this episode of the Functional Nurse Podcast. I am really excited to share this episode with you. I have been busy with the faculty at IFN building the functional nursing program, and I'm putting some of the finishing touches on the introductory module, Module Z1, which is kind of giving an overview of what functional nursing really is. As I'm doing that, I have been thinking a lot about my experience learning functional medicine, what that felt like for me, and what I wish I had known differently or learned sooner. Thinking about all the feedback I've gotten from students and a lot of the live discussions that we've had over the years about this, the experience of learning this approach. And it got me thinking about a lot of things that are common themes that come up a lot. And so I thought I could do an episode where I talk about the 10 truths of becoming a functional medicine nurse or learning the functional approach. And so I thought it would be a fun episode for us to do and just kind of talk about the things that are maybe not expected until you step into it and maybe important to consider. And nobody's ever going to think to tell you this in a class. So I thought we could talk about it. The first one is that you are never going to know everything. And I say that humbly from that personal experience myself. I think getting okay with that sooner would have really helped me because I kept feeling like I was trying to find more and more and more to learn. The reason for that and the reality of it is that functional medicine is different from conventional healthcare. In conventional healthcare, things don't become a protocol. For example, how we approach type 2 diabetes or how we approach hypertension. In school for becoming a nurse practitioner, I learned the protocols for those, and they are created by respected bodies that are experts in that field. And it'll say, for example, you know, start this medication typically first, unless they have this criteria, go up to this dose, and then start this medication or this class of drug, go up to this dose. If resistant, consider this one, refer to this specialist if they get to a third drug, things like that. The evidence that informs that guidance, it takes an average of 17 years for research to make it into evidence and protocols that we're using in healthcare. So, whatever we're doing for hypertension right now in conventional healthcare or for managing diabetes right now in conventional healthcare, and by following the guidelines or practicing to the standard of care, is using evidence from approximately 17 years ago, some older, some maybe a bit more recent. That's scary and terrible. It shouldn't be the case. It's confusing. Why is this such an issue? But when we take a functional approach, something very fun about it, but you just have to kind of get used to also is that we're evaluating the evidence that's unfolding in front of us, right? Every conference I go to, the people that are involved in the research, that are involved in being the leading experts and authorities in the world on these topics, are sharing their knowledge with us essentially in real time. A lot of times they're sharing studies that they haven't even finished yet, that they're in the middle of conducting, but often just afterwards, or they're sharing research that's extremely relevant. I'm in an MBA program right now, and I think it's kind of amusing that some of the studies or articles, things they share for us as evidence is quite dated, and that would not fly in healthcare for a second, particularly in the functional approach. But, in general, if you go back to school for your bachelor's, master's, doctorate, it is essentially understood. You can't be sharing research as evidence unless it's seminal. You can't be sharing things that are over 5 years old as evidence of why you're practicing. Why is that how we're informing care? In the functional approach, we're looking at things that are coming out right now. And as we look at how healthcare is evolving, how our understanding of health, genetics and epigenetics, nutrigenomics, how our food is informing our health. All of that is heavily researched right now, and it would be a shame. Essentially, I feel like it should be a crime. We shouldn't be allowed to care for people with evidence that is that dated. So that's a big one. And so the reality there is that we just are kind of committing to being lifelong learners. And I think most of us are that are into this topic. It's kind of nice to know that there's always going to be more for us to learn. It means that what I told my patients just a few years ago isn't really the best guidance anymore because when we know better, we do better. So things that I learned in my functional medicine training that was very evidence informed at the time has evolved since then with better evidence. And it's our responsibility to stay on top of that. And that's one thing I love about our community is it's a place for us to kind of have conversations about that. Like, yeah, there's research coming out, but is it something that we should really be including in our practice? I love learning more and taking more courses and going to conferences, but I think just having that sense of when you finish a course that you're taking in the functional approach, it's not the end of the story. You don't have to feel like that's the day that you know everything. And if you didn't like retain it all, you're not ready yet. That's like really not accurate at all. And I think that talking about this with my students has really reassured them as well that like it's normal to feel like you don't know enough. Imposter syndrome in this sphere is really a very valid thing that comes up frequently. On a totally different realm, my number 2 is that our bodies are not siloed systems. And so, what I mean by that is in nursing school, we were taught body systems, and most of conventional healthcare, that's how they're approaching patients. So, we have our cardiovascular system isn't working right. Our pulmonary system isn't working right. Our endocrine system isn't working right. And that is how we have approached patients and our thinking. And so it takes some unlearning there for us to accept that all of these things are really interconnected. And the great thing is that when we take a root cause approach and we look down at the roots, the why for people, and we identify that, it can often fix many of the branches or body systems for our patients. And so you might have a patient that has one or several root causes that have caused one health concern or maybe several. So they might have, for example, maybe they have some gut issues and they have some energy issues and they maybe are developing prediabetes and maybe they have hypertension. And all of those things would be in different body systems. But underneath it all, there might be a handful of root causes that we can address that would help address all of those health concerns. We don't look at people as like having a cardiovascular concern. Instead, when we're looking at the root causes, we approach it in a completely different way. We really lean into cellular health and what might be getting in the way of that. And I think that's really undervalued in conventional healthcare, which I think sounds crazy to say, but I mean, when I learned the functional approach and start thinking about the demands of our cells, what they need, and what might be causing harm to them, it's kind of like super obvious, but it just isn't typically a real big part of conventional healthcare. That approach can be a little bit challenging to kind of shift our perspective as a nurse and stop thinking about all those systems. The really great thing about that is if you think about a lot of people that could benefit from functional healthcare have 5 specialists, right? Maybe they have a cardiologist, they have a pulmonologist, they have an endocrinologist, maybe they have a gynecologist, a dermatologist. They have all these specialists they're seeing and each of those specialists is only looking at their health through their lens. And each of them are giving them one or several prescriptions for their problem that they're an expert in. So then this person might end up on 5, 10 prescription drugs. And if we actually taken the time as kind of a generalist to look underneath all of that and look at the root causes instead of thinking of systems, we could potentially fix or drastically improve their health in all of those various areas and maybe get them off some or all of those medications. So that's really exciting. The number 3 that I'm going to share with you is that you are probably never going to feel ready. I touched on that a little bit before, but that is a reality. I have a lot of nurses ask me when they can start saying they're a functional nurse. And my answer is always when you start asking why. So, whether you're working in the hospital, at a school, in your community, like health, regardless of the setting, if you're really being curious and trying to get at the root of what's going on with your patients, you are a functional nurse. And so, does that feel comforting? Probably not. If you don't feel ready yet, you don't feel ready yet. But what I can tell you from talking to over 1,000 nurses and nurse practitioners about this, talking to many nurses about it very regularly in our live meetings, I can tell you that it is just a reality and you kind of just have to step over it and just dive in and it's okay. That's just kind of how it is. You're not going to feel ready, but I think that one thing that can be really helpful is practicing explaining some of the things that are coming up for you to people around you. So, if somebody in your life is curious about what you're talking about, if you can explain it to people, and in particular, if you have a suspicion for a patient, I think that your constipation that you mentioned might be connected to this. You can kind of tell them, and here's why. Then you can teach them what a really great holistic approach would be. That is great, and that can be something that you're starting to fold into your practice. Does that mean that you're ready to take on a really complex patient with several things going on? Maybe not, but that doesn't mean that you can't start practicing with a functional approach. I really think that that's a good gauge for when to use something is if you can explain to your patient the why behind it, it's probably fine for you to use it because pretty much everything we do in functional nursing is optimizing their health outcomes. So even if you're wrong, it's not at the root cause of the concern that they came to you for. It's probably still going to improve their health to address it because we're just optimizing their lifestyle and exposures, diet, etc. Okay, so number 4 is you're gonna want this for people that are not ready yet, and I know we've talked about that some on the podcast before. That can be really hard to accept when you're first learning this in particular. You wanna talk about it all the time, and you wanna share it with everybody. It's very exciting, and not everybody is ready to hear it, and we do not want it to turn into a situation where people are like, "Oh my gosh, I do not wanna hang out because I don't wanna hear about that." So, I think being aware of that, and in particular, if it's that we're trying to share the knowledge to change somebody's behavior, that probably not gonna work unless they came to you seeking guidance. It can be challenging for nurses because we tend to be pretty caring people anyway, and we want great things for people around us to want that for somebody that isn't ready. And then maybe they're talking about it and you're kind of struggling with how much to share or what to talk about there. That is an art. We've talked about it in other episodes. I encourage you to kind of reflect on that and maybe listen to some other episodes along the lines of that theme because it is a challenging thing. I think that the bottom line for me, what I've learned is that we can refer people to ifm.org where they can search for a practitioner in their area. We're building the directory at IFN so that nurses can connect and find other functional nurses to pair up with people in their area. I'm hoping that as it builds out, will be a bigger resource for us moving forward. I just think that us being a good role model for change, we don't, especially if somebody can see us getting better if we're working on our own health, that is role modeling this. And then when people are ready, they know who to come ask and help the people that are ready. I tell nurses when I talk about this, set up your practice, attract the right people, work with them. If you try to change everybody's mind in your community that thinks that it is some woo woo practice, or you try to convince the people at your conventional healthcare clinic or hospital that this is valid, you're probably just going to be blue in the face and run out of air. But you can focus on the people that are there and do believe in this and are motivated and ready for change. And I say a lot, send them back better. Because if a provider in your community thinks that what you're doing is hokey and their patients start coming back and needing to get weaned off their medications or removing problems from their problem list, that can be some pretty great evidence that what you're doing works well for people. Okay, so number 5 is that this is still nursing, and this topic, I think a little bit I could go on a tangent, so I'm gonna try not to, but I think when we're in nursing school, we learn this holistic approach and what is the holistic way to look at our patients and how to support them. And so we as students in nursing school typically have a little bit more time with people, especially in the first several quarters or semesters. And so we're in the room with people, we're providing some education, we're really thinking about their diet, their ability to care for themselves, meet their basic needs, access to food. A lot of the assignments in nursing school kind of set us up to approach human health in that way and to care for our patients with this holistic mindset. And then as we get closer to the end of nursing school, we tend to get more of our clinical rotation in settings that are more fast paced or we're taking on more patients. regardless of the setting. It's a much more rapid fire environment, and that becomes the reality of healthcare. And so we leave nursing school with this toolkit and mindset of a holistic approach, and it becomes really challenging to use that in most settings in healthcare. And so nurses can really struggle with that. And I think that that is at the root of a lot of burnout and a lot of the statistics around nurses leaving the bedside at a really rapid rate not long after school is because it doesn't feel like what asked like kind of called them to nursing in the first place. I say that to say that we get in this medical model and a lot of nurses end up in settings where there are things that have to happen every shift, and it is not a talk about diet and lifestyle, right? It is probably making sure somebody gets medications and that they're compliant with a plan of care, and a lot of tasks and boxes to check and documentation in that regard. It almost, as I've touched on a couple times in the last year, it almost is this idea that nurses are an assistant to the ideas that a physician has. I encourage you to think about it in a different way. And now, a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause whole person care. If you're looking for connection and real time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. When I talk to nurses about this topic and I have them look at their scope of practice where they are practicing, where they're licensed, and reflect on it and maybe write an assignment on it or come to a meeting and talk about it, a lot of nurses throughout the United States and throughout the world that have shared these insights with me, this actually doesn't say anything about physicians on here, or it'll say nurses need an order from a prescribing provider for any medical interventions. It'll have some sort of language in it that's very specific in one section that's about following medical orders for medical interventions, such as medications or procedures. There are absolutely environments where a lot of things that occur are protocols an ICU or an emergency department. There are things that are happening because of the protocols in that environment. And it's understood that the physicians that take on a role there are going to use those protocols. The nurses are comfortable initiating them, maybe even before the physician sees the patient. Emergency department, real quick, we know what labs we need. We know the EKG, all the things that need to happen for chest pain. In reality, if you think outside of that setting, nurses as a profession have essentially, I don't want to use the word brainwash. It's a profession of, it's just amazing to me. I don't want to go too far down the rabbit hole, but that we think that we can work outside of somebody else's orders, or that we're somebody's assistant, or that people view us that way. And if you truly look at your scope of practice, that is not the case. And so I think that that's one of the big truths about functional nursing that nurses come to as they're learning it, is that this doesn't have anything to do with medicine. And yes, a physician might, a patient might have a fungal overgrowth, and we can approach it in several different ways. And maybe a prescription antifungal is the most effective and fastest way to treat that. Doesn't mean it's not going to come back, but maybe there are prescriptions that a physician can use in their functional practice or a nurse practitioner could do. Maybe there are advanced tests that they could get, but the reality is that is not root cause care at the level that we're talking about in functional nursing. That's like adding a layer in of prescription medication, right? That's not functional nursing. It is a mindset shift to really realize that we're stepping aside from feeling like we are performing tasks inside a system where someone is over us. And a lot of nurses that I talk to start to really shift to thinking about it as my patient has a primary care provider. And then they come work with me at my setting, be that that they're a consultant or they offer coaching or whatever their practice is. And they optimize their health outcomes and take a root cause approach. And they might also have a mental health therapist or a dietitian. They have a healthcare team, but the nurse isn't doing tasks for everybody else's ideas. It's truly the nurse's partnership with the patient and the approach that they take on together to create a really great plan that's going to actually work for that person. And so that is very different than saying that we're in the medical field or trying to practice medicine, which I don't think very many of us have any intention of that. I'd say number 6 is sort of like that you're not behind. It's weird to think how much I really wanted to learn functional medicine, like, again, as much as possible when I first came to it, and to see how it's evolved over the years and where we are now. But in reality, it's still a small fraction of practitioners, even I mean, more people know what the word means or they think they do, which we'll talk about in a minute. Um, it's that we are still at the very beginning of this, and nurses that I've worked with in this, learning this and teaching this in many years now, we kind of had conversations about being the pioneers of nurses in this field and that how cool it felt, but also isolating. And I think that that has improved. Nurses feel like they're able to find more holistically minded nurses to connect with. It still sometimes isn't in their community, but in our membership at IFN, we have live meetings all the time and we're in there every day connecting with each other. So it doesn't feel that way to us anymore, I think, but it definitely can feel that way in your own community, especially if it's smaller or they're less receptive. I think not feeling like you're behind because this still is a really emerging practice that people are looking for. And I often have nurses say, I don't know why anybody would want to work with me or how could I even build a practice. But my students in the last several years, particularly this last year, no, people are waiting for me to finish. People are really excited to finally have somebody to legitimately take a root cause approach and not just trade all the prescription for supplements and do IV hydration therapy. There's a lot of things that are adjacent to functional medicine that people are practicing that is not root cause approach at all, 0%. And so people feel misled and they want somebody that's truly going to take a root cause approach. This is just unfolding and you're not late for it. That's kind of my number 6. Number 7 is I kind of just touched on for a second is you do not need a pill or a test or a supplement for everything. Functional healthcare is not about expensive tests and supplements, and that's a big misconception. It's also not all those other things. In my really recent episode, I was talking about my family member that went to somebody saying they practice functional medicine and they're just selling supplements, hormone replacement therapy, really expensive tests, but not a lot of training on the results or on a root cause approach. So, zero discussion about lifestyle or nutrition or anything like that. There are a lot of practices that have functional medicine on the door and they are selling supplements and ordering expensive tests. So, I encourage you, if you didn't hear that yet, to listen to that episode. If we're taking a root cause approach, we're not adding things in so much as figuring out what things maybe need to change or what things, if we need to address someone's nutrition or their gut health or their stress or sleep or exposures, their relationships, their self-care, self-talk. There are a lot of themes there, but they are not about prescriptions and tests. And yes, sometimes a test can be really useful. They're super fun to look at, I think, and they can get people results faster in many cases. But often, we've been talking about this in the membership a lot lately. A lot of the times, people want the really expensive, fancy ones. And if we haven't taken a root cause approach, we are just like wasting their money. And so, putting that off and taking the foundational approach first is, I think, ideal for people cost wise, and because that's what's really going to help them sustain and improve long term. Okay, so I touched on the unlearning just as much as you learn. That is number 8, though, is you're going to unlearn things just as much as you're going to learn things. And I was talking about framing module 1 in the program and getting that ready to post for the students starting soon. And just the concepts there are a lot of those things are just me figuring out how to present these new ideas to shift the way that we arrange the patient's story so that we have a better picture of what might be going on underneath. Because the way that we have been taught to do it in conventional healthcare isn't super great at getting to the root cause. And so if we can organize the patient's story in a different way and ask better questions and listen for the themes that might be coming up and kind of plot out their story for them, that can be what really makes a lot of difference for them. And so we have to unlearn some of the approaches that we've taken in nursing school to organizing our thoughts and how to think about the human body. I mentioned earlier cellular health. That I think is a big one, unlearning things and kind of getting over some of the assumptions that we have about health. As I wrap up this section, I will say one big thing that comes up for me is the idea that of healing. Like I mentioned in a recent episode that when I was a primary care provider, we were really locked in our clinic on the training was about adding the medical diagnoses and not just adding it, but making it the most specific possible because that was how reimbursement was going to take place. The more complicated the patient was, the more insurance was going to give our corporation to manage that patient. And so you can't remove problems and make money. And that's the reality of corporate healthcare. There's not a lot of healing going on. I've heard a lot of whistleblowers from the pharmaceutical industry recently talking about the idea that if they did find a drug that healed something, they would scrap it and shift to finding something that just kind of suppressed symptoms. And that's been their focus for the ages like that. If there's something that you take for a month and you no longer have asthma, why would anybody want to release that if their business is selling pharmaceuticals long term? They want people ill chronically. We have patients that are used to this and this idea of going in and getting something for their problem. And it's not knowledge, right? It's not empowerment. It is typically a prescription drug. I didn't do a ton of urgent visits, but when I did, if I thought it was a viral illness and I talked about home care and immune health and things like that, I always felt like they left like feeling it wasn't enough. They wanted a thing to feel better. Back to that unlearning, really touching on that, but also just the idea of we can heal patients and we can reverse illnesses and we can remove things from their problem list. And that's not really popular in conventional healthcare. And it doesn't make big pharma and corporate healthcare money. It's a lot of my students have decided to have their own practice for that reason. The next one, number 9, is patients will feel the shift and they're probably going to feel it before you do. And by that, I mean that I think about the first people that I started sharing when I started to be able to do that thing I said earlier, share why for somebody. I had that constipation example. So explaining to somebody something that we could work on that I think would help move the needle for the health concern they're here for, right? You explain that to them and it makes enough sense that they're like, okay, tell me what to do. You talk through what that might look like for them. If we're talking about constipation, then we might talk about several factors that stand out as maybe effective for that person. Develop a plan of care in partnership with them, and they leave, right? You're feeling really great. I was able to say that. It came out right. I think it made sense. They seem to believe me, and we'll see how it goes. They're at home trying out what you recommended. And I will tell you, an elimination diet is a great example of this. Connecting the dots for somebody to where they're willing to try that and then sending them home. So, all that to say, when they come back, it's kind of wild when you start doing it and people come back and they're just better. They are getting results before you really have that evidence as a provider that what you have learned about the functional approach is really going to help people. And then people start coming back to see you and they're like, oh no, I started having a regular bowel movement and this improved. And I started cutting out foods that seemed to be bothering me and this improved. Or somebody doing an elimination diet and having significantly or 100% improvement in their health from removing inflammatory foods. And as I said in a recent episode, there's still work to be done in that case, but people can get drastically better pretty quickly with a functional approach, especially as you develop the skills to, we can look at a person's intake and see maybe 5 things we could work on. But the more you do it, the better you get at is probably this. And I'm going to try to get them some buy-in and see if they would do a little experiment with me, right? Let's work on the constipation, see if it helps with the hot flashes. And they're going to think you're crazy. So you have to do some teaching. And then next thing you know, they come back and they're so happy and they feel so much better. And that is not always the case. I mentioned earlier, a lot of this is hypotheses. So we can address something that we want for them regardless, and it might improve their health long term, but it might not improve that symptom that they're really coming to you for. So now you have to say, okay, what was 2 through 5? Let's start working on number 2, the second most likely thing that they're willing to work on right now. There are a lot of nuances to this. That's why I always say there's not real protocols if you're truly practicing in a root cause approach, because it's different for every person. Okay, so our last one is that this is probably what you've been looking for. And by that, I've said this a lot. I know it's kind of a broken record, but this is what I had always been looking for. This is why I went to NP school, and that wasn't what I was looking for. It is very aligned with why I became a nurse, and that is what I've heard from so many nurses. I think a lot of nurses that think that they're burned out, that they don't wanna be a nurse anymore, that they just can't do it any longer. It's because they're not practicing in alignment with their values and what called them to their profession, and I think, I think a lot about passions and dharma and doing the work that you're here to do. I think it's interesting when I talk to people, it's rarely nurses, but just other people in my life, or if I'm just kinda chatting with somebody in an event or something, and they're like, their job is just a thing they go do, and it doesn't bother them that much, or maybe it's a little bit stressful, but I don't think a lot of people carry what we carry with our profession, how we feel about what we do. I think it's a really important thing to acknowledge that our system isn't sustaining that for us. It's not creating space for us to step into that fully. I think it's really exciting that functional nursing is essentially creating space for us to be the type of nurses that most of us wanted to be and what called us to the profession. So that's my favorite one, is that this is really what nursing was meant to be. The last several months have just been incredible for me because launching our program and having so many students join us and so many amazing faculty. If you haven't checked that out yet, I encourage you to. It's just been really inspiring for me. I'm really excited to connect with people at the conferences coming up in the next several months. And just I've heard from just hundreds of nurses, and everybody seems really inspired and hopeful. And I know there are a lot of things in the world that we don't feel like we have enough influence over right now, but I think that we can take more, I don't know what the word is, but we can take responsibility for what we're offering and make that better. And I think that we can really help healthcare a lot more than we realize as a profession at the moment. I think that nurses really play down just how many of us there are and how much we could do to change the world and healthcare if we would just believe that and step into it more. So I'm glad that you were here with me today. Thanks for listening. I hope that this was inspiring or insightful if you're new to functional nursing. And until next time, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.